Hello, my name is Allison, and today I will be presenting on the findings of my Community Health Needs Assessment of Portland, Maine. The assessment was completed using both quantitative and qualitative data collected through online databases, qualitative interviews with community leaders, and a windshield survey. The goal of the assessment was to determine the overall health status of the community and to understand the programs and services that fulfill their needs and those that are lacking. This will help community leaders determine appropriate action to improve the health and well-being of Portland. Portland is a beautiful, historic urban city located in Cumberland County, Maine, and has a population of 68,408, which has increased by about 1,500 since 2017. Portland makes up about 5% of the population of Maine, while making up only 0.2% of its area in square miles. This demonstrates the urban nature of Portland inside a very large rural state. Most of the city of Portland is situated on a peninsula with areas for residential living and a diverse infrastructure. Portland contains some of the most diverse areas of Maine. However, Maine is the least racially diverse state in the country. In terms of race distribution, Portland is more diverse than Cumberland County overall, with 84.6% of the population being white alone compared to 92% in Cumberland County. This percentage is about 8% higher than the white alone population in the U.S. The African American population is 8.4% in Portland. Portland also has an increasing number of foreign-born citizens at 11.1% compared to the national average of 13.6%. This bar chart demonstrates that most of the foreign-born population in Portland and in Maine overall entered in the year 2010 or later. The median age of Portland is 43.8. The percentage of persons under 18 is 6.7% lower than the national average of 22.3. In terms of education, Portland has a higher percentage of high school graduates at age 25 plus at 93% compared to the national average of 88%. The percentage of adults 25 and older obtaining a bachelor's in Portland is 52.6%, which is over 20% higher than the national average. In January of 2020, Maine had an estimated 2,100 people who experienced homelessness on any given day. That's almost 0.2% higher than the homelessness rate in the U.S. overall. When looking at income and poverty, Portland poverty level is 14.6%, which is over 3% higher than the U.S. average. Median household income is also less than the U.S. at $60,467. Part of the community assessment consisted of a windshield survey and an interview with two community leaders. The first community leader was Kirsten Foucher, coordinator for the Portland Public Health Division. Kirsten described Portland's community as ethnically diverse when compared to the rest of Maine, and noted that citizens in downtown Portland generally have a higher socioeconomic status, however, with a high homeless population. This is something I noticed during my windshield survey as I saw homeless people taking shelter in various neighborhoods and areas. The second interview conducted was with Dr. Teresa May, a neurocritical care physician at Maine Medical Center in Portland. Teresa also noted that Portland's diversity has been growing over the last decade. However, some minorities and current residents of lower socioeconomic status can no longer afford to live in Portland because of the increased cost of living, creating tension between the socioeconomic groups. Teresa believes that Portland's greatest healthcare asset is the abundance of healthcare facilities available, including specialty care offices and community health centers. This was evident in the windshield survey, as several specialty healthcare facilities and walk-in centers were observed. Various health indicators have been collected to create a health profile of Portland, Maine. Overall, the health issues that stuck out from the report were tobacco use, drug abuse, and overdose rates, and food insecurity. First, the leading causes of death in Cumberland County in 2019 were cancer, heart disease, and accidents, respectively. In 2018, Portland had 83 deaths per 100,000 from coronary heart disease, a rate greater than Cumberland County. Cancer deaths from 2012 to 2016 in Portland were 166 deaths per 100,000. This is higher than the overall cancer death rate in the U.S., which was 156 deaths per 100,000. In terms of food insecurity, Cumberland County has the largest number of food insecure residents. In 2019, Maine had the highest percentage of food insecure residents in New England. About 37,000 residents were food insecure, including 17% of children. That is almost 2% higher than the U.S. average. Another preventable health problem that is associated with heart disease and cancer is smoking. In 2016, the percentage of adults in the U.S. who were current smokers was 15.5%, compared to Portland at 16.5%. The health problem which was deemed to be of highest priority in Portland is tobacco-related lung cancer. The CDC states that smoking cigarettes is associated with about 80 to 90% of lung cancer deaths in the U.S. Tobacco-associated lung cancer is a priority health issue for Portland because of its high incidence of mortality, economic impact, severity of illness, and preventability. In 2018, the rate of lung cancer deaths in Portland was 50.4 deaths per 100,000, which is well above the national average of 34.8 per 100,000. New cases of lung cancer per 100,000 in 2010 to 2014 was 68.4 per 100,000, compared to the U.S., which was 43.2 per 100,000. With a higher incidence and mortality of lung cancer in Portland, there is also a higher average percentage of adult smokers, which, as I mentioned, is over 1% higher than the national average. As with many preventable health issues, smoking and lung cancer disproportionately affect vulnerable groups, including African Americans, immigrants, and those of low socioeconomic status. The American Lung Association, or ALA, reported that military veterans are also disproportionately affected by cigarette smoking in the U.S., reporting that they smoke at an average rate of 21.6%. In the 18 to 25 age group of veterans, 50.2% smoke. This may be contributing to Portland's rate, as over 4% of its population is military veterans. Portland's disproportionate poverty level may also be contributing, as the ALA reported that compared to people with a family income 3 times the poverty rate, people in poverty smoke almost twice as many years, and they smoke more heavily. In order to serve the growing population, Portland has vast community assets that serve the needs of all residents. Some of Portland's greatest assets include its healthcare system and the Portland Public Health Division, which implements programs targeted towards vulnerable populations. Portland is home to Maine's largest hospital, Maine Medical Center. Maine Medical Center is a not-for-profit 637 licensed bed teaching hospital and has a Level 1 trauma center. Other healthcare services include Care Partners, which is a volunteer network of providers in Portland who donate medical care to those with low income and no insurance. Portland also has various healthcare resources to support its veteran population. The Portland Vet Center provides free services for eligible veterans and their families. The Portland Public Health Division is also a major community asset for Portland. The tobacco prevention program in the Health Division is funded by Maine Health to implement tobacco-free policies in Cumberland County. The Minority Health Program also works under the Public Health Division to reduce healthcare disparities through community outreach. Portland is also equipped with educational entities for all levels, which includes 10 public elementary schools, 3 middle schools, and 4 high schools. The Portland School Multilingual Department supports multilingual students and families, helping them to register for school, and provides interpretation services. This comprehensive assessment will allow public health leaders to develop appropriate prevention efforts, which include assessing the determinants that affect the rate of smoking in vulnerable populations, evidence-based school prevention programs, and a ban on the advertisement, promotion, and sponsorship of tobacco in Portland. Thank you for your time.